Hi, my name's Lynda Napier from Clear Day Therapy. I'm a Rosen method practitioner, a remedial massage therapist, and I have a specialty in oncology massage. I also teach workshops in the Rosen method, the skills of the Rosen method for 1 or 2 day workshops, and I'm a teacher in training for the 8-day intensives of the Rosen method that we teach twice a year in Australia with teachers from overseas. I've been practicing Rosen as a practitioner, as a Rosen method bodywork practitioner for well over 7 years now. What it's about is focus. It's about self-awareness, about really listening to oneself, and through that process finding where we are tight, where we've got tension in our musculature, but also tension in our life and how we interact with our life, interact with others around us. We begin with a talk about you, why you've come, what is happening with you in your body, and a little bit about what's happening in your life, because that's really relevant to what's happening in your body. The way we are, we express who we are and how we are through our musculature, through our muscle tension, the way we shape ourselves. So the session, the hands-on part of the session, is looking to help you become more aware of how you live in your body. I look for places of tension and where there can be ease, and I look for places where there's ease and movement, and give you some of that reflection back. It makes a difference to know how we are in our body, and the facilitation of my hands and a little bit of talking that I do to give you that feedback can be transformative, it can be life-changing. Remedial massage is a great toolkit for working with people who come in with all sorts of different problems in the body. Remedial work that I do includes some aspects of pain management in moving towards the pain and feeling a little more of it, and what happens through that process is that it lessens. I've been working with a client recently who's had 30 years of pain, and she really loves that she can go away from the session, feel her pain start to come again, and use some of these really simple techniques of breathing and easing the tension in her body. And what she's telling me is she doesn't have to take quite as much of the painkiller as she used to. Now that's a great outcome, that's a great health outcome. And she feels better, she feels a little more in charge of what's going on with her. Another area that I love working in is oncology massage. When people have a diagnosis of cancer, they're going through active treatment or they're in remission, it's a time of great concern and worry, and while medical interventions are life-saving, they're often not nurturing, and often clients come to me because they've got a little out of touch with their body. It's as though they don't want to be there because of the impact of all of these things that have happened. So oncology massage is a place to reflect, have some quiet time to really reconnect with the body and to relax, because that's one of the things that's really hard to do when somebody says that a person has cancer. If you're in pain and there's no medical reason for that pain, you've had that checked out. If you're a person who's too busy, over busy, and find that you haven't got enough of yourself to go around, if you feel that something's got to give, something's got to change, and you don't know what that is, then I would welcome a conversation with you at Clear Day Therapy, and we'll see where that goes. We'll see if there's anything that I can do to help you.